Although it may not seem like it, yoga actually has many mental and physical health benefits. For one, it challenges people to learn more about their sense of self by doing some breathing exercises and makes them strengthen their balance. In yoga, balance is key.
Most of our balance is controlled by the structures in our ear. There are two major areas of your inner ear, the hearing area and the balance area. You hear with the part of the ear called the cochlea and balance with the vestibule and semicircular canals.
Within each of these parts is a little maze of tissue, fluid, and hair. The little hairs within your ears aren't like the hair on your body. They serve a much different purpose. They're extensions of nerve cells.
When you move your head, this fluid shifts, which makes the hairs move and signals to your brain what direction your head is moving in. Certain problems with the inner ear can throw off your balance in yoga class by affecting the information that your brain receives from those little hairs.
A cold or other illness that makes your nose and sinuses stuffed up can also affect your inner ears. Often only one ear is infected, which throws off your balance because one ear is sending accurate information to the brain and one is sending inaccurate information.
In addition, several recent studies suggest that yoga may help strengthen social attachments, reduce stress, and relieve anxiety, depression, insomnia, and PTSD.
You can use psychotherapy sessions to practice yoga's mind-body awareness and breathing techniques. Simple strategies such as encouraging clients to get as comfortable as possible during their sessions or to pay attention to how their body feels when they inhale and exhale teach clients to be in the here and now.
There are two primary levels of yoga psychotherapy. 1. Behavioral changes and the development of a stable ego. 2. Deep psychotherapy that supports the journey from limited, socially conditioned consciousness to the awakened, authentic self.
Yoga also helps fulfill some of the steps in Maslow's hierarchy of needs, such as esteem and belonging, which explains the humanistic side to yoga. According to Stanford University health psychologist and yoga instructor Kelly McGonigal,
in a yoga class, everyone is moving and breathing in at the same time, and I think that's one of the undervalued mechanisms that yoga can really help with, giving people that sense of belonging, of being part of something bigger.
A person's esteem is reinforced by the sense of accomplishment when successfully doing a difficult pose.
Yoga targets unmanaged stress, a main component of chronic disorders such as anxiety, depression, obesity, diabetes, and insomnia. It does this by reducing the stress response, which includes the activity of the sympathetic nervous system and the levels of the stress hormone cortisol.
The practice enhances resilience and improves mind-body awareness, which can help people adjust their behaviors based on the feelings they're experiencing in their bodies. Recent research on the neurochemistry of yoga provides some clues about how yoga might exert anxiolytic effects. Classical anti-anxiety medications work by encouraging the release of GABA in the central nervous system. GABA was shown to be significantly higher in the brains of those subjects who had been doing yoga. The study also compared GABA levels directly before and after an hour of yoga and showed a 27% increase.
In conclusion, yoga both affects the brain and is affected by the brain. It can be a non-invasive remedy to many mental health issues and proves to be an effective way to lower stress and anxiety.
We should all take some time out of our schedule to relax and breathe, because it is better to release our emotions through exercise than sit and dwell on our issues.